morning, everybody. Welcome to our Q&A session for Monday, 23rd of June. Now, great to see such a wonderful number of people from around the country that have jumped onto this session tonight. Hope wherever you are around the country that you're warm and dry. It is my absolute pleasure to introduce our fantastic speaker tonight, Dr. Shaun Holt. Now, Shaun holds pharmacy in Nottingham in the UK and medicine, Sheffield in the UK degrees. He's conducted over 50 clinical trials and has over 200 publications in the medical literature. He's a global expert on the science behind natural products and therapies. He's the author of 10 books, including the bestseller Natural Remedies That Really Work and Medical Cannabis, a brief guide for New Zealanders. Shaun was a finalist in the 2015 New Zealander of the Year Awards and in the Innovator category, and a finalist in the 2019 New Zealand Entrepreneur of the Year Awards. Absolutely wonderful. As well as multiple appearances on radio and TV shows. He's given TEDx talks and appeared on a Netflix documentary. So he comes absolutely highly sought after. Now, while it is 7 o'clock New Zealand time, it is 8 a.m. in Manchester, and Dr. Shaun, we thank you for the early morning session. Now, some of you will have come to some of our other Q&A sessions where we have a speaker speaking for about 40 minutes, but we're doing a little bit different this time, and I'm going to be asking Dr. Shaun some interview questions, and then Shaun will answer, and then at the end of that, at the end of about 30 to 40 minutes, we'll do some live questions. Now, just before we get started with you, Shaun, I just want to say the disclaimer here that so Shaun will not be providing any medical advice or answering any questions specific to individuals' medical situations. What we do is encourage any of you to speak to your doctor or oncology team regarding any personal health or treatment plans. So, so I just wanted to mention that before we started. So, right, I think it's time that we brought the wonderful Dr. Shaun on, and let's get this questioning underway.
Good evening. Thanks for that.
Wonderful. So, now, would you like Shaun or Dr. Shaun? What would you like?
Oh, Shaun, please. I'm aware for Shaun.
Right, fantastic. Wonderful, Shaun. Okay, so to begin with, could you explain what are complementary therapies, or CTs, and how they might fit alongside conventional cancer treatment?
Sure. So I think the best definition of complementary therapies is non-mainstream health practices, which are used alongside conventional medical treatments to support overall well-being, manage symptoms, and enhance treatment outcomes. So it's quite wordy. So it's not just natural products. And also, importantly, they're not intended to replace standard care, but to complement it, as in the name. And I would also add, really, they focus on wellness, often reducing stress, improving quality of life, that sort of thing, which is really important and often not the focus of standard medical treatment.
Sure. Okay. And so complementary therapies are sometimes thought of as an alternative treatment. What's the difference then between alternative and complementary?
Oh, a big difference, and something I'm very hot on. So an alternative medicine or alternative treatment is when someone replaces standard care from a doctor or a healthcare provider with something that's non-mainstream, often from the natural world, and I strongly advise against that. Really, we're talking about complementary using with, not alternative using instead, and they do usually fit nicely together.
Sure. Okay, that makes a lot of sense. Now, a lot of people may be skeptical or confused about complementary therapies. So, what's one common myth or understanding that you might encounter, and how do you respond to that?
Sure. Well, I'll give you two, actually, if you don't mind. So a couple of fallacies are here all the time, and I'm not blaming anyone. I can understand why people will think this. So the first one is people think, well, if a little bit of something is good for me, then a massive amount must be really good. So it could be anything. It could be vitamin D. Well, vitamin D is good for you, therefore have a massive amount of vitamin D. And almost always that's not the case. And just a small amount tends to give you most of the benefits. And if you have lots and lots, you then get into potentially side effects and problems. And related to that is the fallacy that everything natural is safe. I mean, it's just not true. Enough water can kill you, so it's just not true. So, although things are natural, they generally have a safer profile. That doesn't mean they're perfectly safe and you can do what you want.
Okay, cool. So can complementary therapies be grouped into key areas like nutrition, physical activity, and mental well-being? And maybe some examples of those. And does research support the benefit of using a combination of these? So, is it all or just one or two, or what's your thoughts?
So when it comes to complementary therapies, there are literally hundreds. And every session I give, someone will mention one I've never even heard of, even though, I focus on this as my area of speciality and expertise. So I think a really useful way to think about all the dozens and dozens of complementary therapies is in 5 groups. And that's the way I think about it. And there's actually an official classification along those lines. So just to tell you what those 5 groups are, because we'll cover them all today. The first would be alternative medical systems. So this is ways of thinking about health and disease that are nothing to do with our Western trained view of these matters. So, for example, Chinese traditional medicine, Indian traditional medicine, even something like homeopathy or acupuncture, not something that are part of the Western training. So that's the first one. The second would be mind-body interventions, where we try and use the power of the mind. So there's no physical interaction with anything, just using the power of the mind, which is really powerful. I can give you examples of that. The second would be physical therapies. Sorry, the third would be physical therapies, where something is physically done to the body. So that could be a massage or a chiropractor or something like that, where we physically manipulate the body. The fourth of the 5 would be ones we're probably more familiar with, where we take something into our bodies. So a supplement or a diet or a pill or a drink. And the final one would be certain types of energy therapies. And the best example of that, I think, would be a TENS machine, transcutaneous electrical nerve stimulation, a little box that gives out electrical currents that can help with certain types of pain, so using an energy. So that's a long-winded answer because there are so many therapies. But that's a good way to think about the 5 different groups. And they've been often well researched, but some haven't as well. So there's a big mixture. Some have been well researched, some have had no research. Often they're in the middle. They've had a little bit of research. We don't know exactly what's going on. Not much research has gone into your other question, which is combining with standard treatments at all. So they're usually just studied on their own, but it's reasonable to assume that they're going to work well if the science or logical reasons why they might work.
So how would somebody choose, what to select, what type of treatment to select, therapy to select?
Well, there's a couple of ways you can choose because it's overwhelming. I think it's overwhelming, and I study this all the time. One is choosing what you actually fancy taking, what works with you. So I gave those 4 classifications. And what I really love about this field is there's something for everyone there. You might be more into taking a pill, you might be more into doing an exercise, you might be more into the spiritual side of things. It doesn't matter. You can pick and choose whatever works for you. Or what most commonly happens is people pick and choose a whole heap of things. So people with cancer who use complementary therapies, which is most people, the average number would be 7. And that tells me straight away, people are choosing a lot of things. And that makes total sense to me. A lot of people are committed to doing the most they can for their health and well-being. So one thing is to choose what actually works with you. And I think the second part of choosing is what actually works and what's safe. And that's really hard. And this is what we're talking about today. So how do you know what works and what's safe? Going to the internet, unfortunately, is unlikely to give you credible evidence. If you get to the correct website, that's great, but it's really hard. So I've written a book, of course, on the subject. I'm biased. I think that answers a lot of the questions. And there are some good websites as well. So the ones I recommend there's one called WebMD. If you write that down, that's more medical focused. WebMD. It's free, and I think all the advice in there is very high quality. And the other one is the Mayo Clinic in the USA.
Um,
You've probably heard of the Mayo Clinic, the most famous hospital in the world.
mm,
I've been fortunate enough to lecture at the Mayo Clinic. I know the director of complementary therapy as well, and they have a great site, particularly focused on complementary therapies. So that's just a couple of examples of good websites you can get good information from to help to choose.
Great. I think that's super helpful for everyone. So how do complementary therapies work alongside traditional medicine? So what role do they play in an overall treatment plan with someone going through?
Sure. So generally, almost always, they're not there to cure the condition. And that's really important. Now, there have been some treatments from the natural world that have proven useful for cancer treatments, for the cancer itself. So the great example is one called Taxol, Taxol. That's a cancer drug, a pharmaceutical. But that comes from the yew tree originally, so from a natural source. It's fantastic. But that's more the exception. Generally, we're not talking about cures. There are things like that, and there will be more, and they'll go through clinical studies, and then they'll be prescribed by an oncologist to treat a cancer. But that's generally not what we're talking about here. What we're talking about is things to support a person. So that could be supporting the symptoms you're getting from the disease. It could be symptoms you're getting from the treatment, because some of these treatments are heavy duty, with side effects, unfortunately, often. Or it could be just to increase your general health, which I think is so important for everyone, including people with cancer. And also it can be for reducing stress, for increasing well-being, for improving quality of life. Again, those really important things that maybe your oncologist is not completely focused on, and rightly so. They're focusing on the cancer itself, and fair enough. And sometimes these other important parts can be neglected, and we can maybe take control ourselves of those.
And it's maybe giving yourself permission to do those things, isn't it? Do all that well-being stuff because that's good for you.
Absolutely, but as well as permission, but taking control as well. And I hear that every single session. When you're in the medical system, you often feel, and it's not the fault of anyone in the system particularly, but you often feel you're losing control. Others are making decisions. You're in this treadmill of healthcare, and so by using complementary therapies, you're gaining a lot of control back, I think, to your overall quality of life.
Yeah, for sure. So with that then, is it important for cancer patients to talk to their clinical team before starting complementary therapies? Why is that so, or why not? Or what's your thoughts there?
Yeah, I think it's really important to keep them informed. And things have changed. I've been doing this for 25 years now. And at the start of this, a lot of healthcare professionals were pretty skeptical about a lot of these things, didn't know much about them, and would actually advise against them a lot of the time.
Yeah.
I think this has flipped now. Pretty much every health professional I've spoken to recently is very open-minded about the use of complementary therapies, provided this safe. That's the key thing they're worried about. If they're also effective, even better, but really safety. So in terms of asking before you start, I think a bit of common sense. If it's something that's, there's no way it's going to affect you or your treatment, then just go for it. So if you want to start yoga, no one's going to object to you starting yoga. But if you're taking a cocktail of supplements with some pretty potent, powerful ones in there, then you would want to run that by your health professional first.
Sure. Okay. How can complementary therapy specifically help someone going through cancer treatment? So what are the benefits? And do you think carers or family members can benefit from them too?
Yeah, so for people with cancer, I think I've sort of maybe alluded to this above.
Mm.
We're talking about general support, general health, helping with symptoms, quality of life, well-being, all those really important things. So that's where they're going to help in particular. And for carers as well, we often forget about carers. Can be very, very stressful and hard on their health as well. So I think there's a big role there as well. And maybe we'll talk about stress a little bit down the line, but it's one thing I'm obsessed about. I'm obsessed about stress because it's so bad for your health. We're all stressed these days. And of course, if you have a diagnosis you don't want, or you're looking after someone with a bad diagnosis, that's going to make you stressed as well. Of course it is. But when you're stressed, it puts up your blood pressure, your heart rate, your respiratory rate, so much stress on the body, which is going to affect your health in so many ways. And so a lot of the maybe what doctors will call the softer therapies that I would recommend, say things like art therapy or
Mm.
aromatherapy. And some doctors would be a bit skeptical at that. But I'll argue, no, no, no. If these are working for someone's stress, and for a lot of people they do, then I think that's priceless when you're trying to be healthy.
Sure. And I guess that being together as a family or a unit, or your support people, making sure that they stay in the best condition too.
Of course, absolutely. So again, it's not for everyone, and if people don't want to, that's fine. But I think there's some really good options there for everyone to be de-stressed, healthy, and happy in a stressful time.
Yeah, sure. And really good you've talked about the websites, the WebMD and the Mayo Clinic. So we hear a lot about the importance of evidence-based medicine. Is there research that supports the use of complementary therapies in cancer care? How are these therapies studied and proven effective? I know you've done a lot of work yourself, so tell us about
Yep.
that.
Yeah, there's a lot of high quality studies on complementary therapies in the medical literature. There's a lot of rubbish as well, to be frank. So again, going back to my book, I've tried to take the best of them out there and put them in the book. However, there are some therapies that just haven't been studied, so we just don't know. And I say a lot that are in the middle, where they've had a couple of small trials, a little bit promising, but you could never base anything on that. So for things like that, for example, where there's not a great amount of evidence, and this is where I differ to some of my medical colleagues, and we differ on a few little things. But if something's not been totally studied and therefore it's not proven beyond doubt to be effective, as long as it's safe, so that's really important. I'm all for saying, look, give it a go. There's not much downside here. Give it a go. If it seems to be working for you, carry on. If it's not working, then stop. I have no problem with that. I don't need to see 50 studies proving it beyond doubt before I recommend something or say people can try it. And that's, some doctors will. They'll want it absolutely case closed, proven like a pharmaceutical medicine. And there's not too many proven to that level of evidence because it's expensive. Clinical studies are very expensive. And there's very few people or organizations have the budgets that pharmaceutical companies have to develop pharmaceutical. I'm not saying there's anything wrong with pharmaceuticals, but there's often a lot less complementary therapy research just for financial reasons.
And timeframes, I guess, too. It takes a long time to prove studies like that as well, doesn't it?
Oh, it takes a long time. I mean, some of the things I've worked on, there've been 7 or 8 year projects to get
Yeah.
to the answer. That's a long time and several studies and lots of money.
Yeah, yeah, for sure. So
Yeah.
given that, there's lots out there that can be helpful, is there any of them that you would recommend, say maybe with caution or even avoid? Is there anything people should be aware of?
Oh, absolutely. And if you Google me, you'll see that I'm contacted regularly by the media about one specific product. So I'll mention one specific product, and it's called Miracle Mineral Solution. I don't know if anyone's come across this. It's been around for 15 years. It's rife in New Zealand for some reason, and it's bleach. It's industrial strength bleach,
Oh,
which you would use to clean swimming pools, and it's touted as a cure for all sorts, including cancer, and you're told to take it until you vomit and then reduce the dose slightly. It's awful. It's dangerous. It's not going to work for anything. And again, I'm not blaming anyone who tries this. People can do whatever they want, and it's very, very persuasive when you see it. It's touted as being proven when it's not. Something we call pseudoscience. It looks scientific, but it's not. It just looks that way. So it's probably got other names now. It keeps coming back, but it's a concentrated bleach that you drink. You don't need me, a doctor to tell you not to drink bleach, but some people do. Some people are desperate. Some people fall for the deception involved. So that's a specific example. Just in more general terms, I think I've mentioned this before. I don't really advocate massive doses of anything. Some people take huge doses of things. An example of that, say ginger. we'll maybe get onto ginger later. I love ginger. It's amazing for nausea. It's as good as a drug if you get the correct dose. But again, if you have too much ginger, you can have side effects. It can make your blood too thin. You wouldn't think about things like that. And just the other one to be aware of really would be, again, related to extremes, would be extreme diets. I think diet's really important. We'll maybe cover diet a little bit more. I'm, obsessed with having a great diet. It's so important. But some people will advocate diets that I call extreme, where like a lemon detox diet, which is just a bit of lemon and water, really, or some diets that are just a couple of vegetables and nothing else.
Yeah.
Missing out whole food groups. That's not going to end well. You're going to be missing a lot of nutrients. So I don't think extreme diets are good either.
Yeah, sure. And you do hear those, don't you? So it's a matter, I guess, of sifting through and getting that good balance. So if you had to choose then, what are the top 3 complementary therapies you'd recommend for cancer patients? And why, what's your thinking around them as to why they're so effective?
Yeah, well, I do actually have a top 3. It's more a top 3 studies, actually. Top 3 studies that I've seen about different therapies that have really inspired me. And I just think, wow, this is an amazing field to be working in, and we should do more of this. So those 3, well, one I've just mentioned, simple old ginger. So there have been studies in the USA in oncology centers for chemotherapy-related nausea and vomiting, which is really severe, and it's usually treated with very, very heavy-duty drugs, often injected. But what they found in one particular study with about 600 people, massive study, was if you got the correct dose, ginger was as good as any of these drugs. And I think that's just a wonderful finding. And before everyone asks, I'll tell you what the dose is. The dose is 0.5 gram a day. 0.5 gram a day of ground ginger spread over 24 hours, in one dose or spread over, which is quite a lot, actually. But that dose was, as good as anything for nausea. A second one, more on the mental health side, would be a study that looked at omega-3 fish oil for depression. And also in the study, they had people with a standard antidepressant, Prozac. And what they found was that fish oil was as good as Prozac in people with severe depression. I think that's just a remarkable finding. I must stress, anyone who's taking that, don't stop it and start the fish oil. You should if you're going to do that, do it with your healthcare provider, because you shouldn't stop antidepressants suddenly. You need to taper them down. But anyway, just telling you about the research, for me, that's a remarkable finding, and one I don't think a lot of doctors are aware of, to be frank. And the third one, this is pediatrics, actually. And this was a study on children with leukemia. And part of their treatment plan, they had to have a bone marrow aspiration. And people on this call will have had a bone marrow aspiration. It's a very unpleasant procedure. It's a huge needle into the hip bone, very, very painful. And unfortunately for the children, it was a required part of their ongoing treatment on a regular basis. So you can imagine for those children how awful the procedure would be. But not only that, then thinking about the next time they're going to have it. I know I'd be just petrified the whole time of, that would be as bad as anything for them. So on this study, what they did hypnosis around the time of the procedure, something we don't really understand at all. And lo and behold, for a lot of the children, they had to have the procedure, unfortunately, but they forgot about it with hypnosis. So they then didn't spend their next weeks and weeks worrying about it. So imagine what a difference that would have to their quality of life. So that's just 3 examples. I could talk all day, but they're 3 of the most inspiring ones that I've come across.
And like you say, multifaceted, so they work across a whole range of different aspects. Yeah. So now taking care of yourself is obviously very important, but that's also both during and after treatment as well. So how can complementary therapies support cancer patients in their self-care journey? So, is there a start here and a carry on, or any change, or?
No, I don't think so. Again, the things I've mentioned before, supporting good health, side effects, obviously if you're no longer, receiving any particular treatment, there's probably no need to treat any side effects of those. But in general, it's just all about well-being and general good health, both before, during, and after any treatments.
Sure. So in terms of Look Good Feel Better, we've learned from recent Look Good Feel Better research that many cancer patients do turn to complementary therapies for mental well-being or to reduce stress. So how does CT help manage symptoms like stress and anxiety, I guess, and improve overall well-being? I think that's probably quite a big thing for a lot of people, is that stress and anxiety.
Yep, absolutely. And, I've already talked about it, really, really important. And so, from all those 5 groups of treatments I've talked about, there are things for stress and anxiety. I mean, there's just too much to list now. But, there's things like yoga, for example, and meditation, fantastic evidence for those. If you want to pop a pill, omega-3s and B vitamins, potentially good as well. Massage, I mean, who doesn't like a massage? But there's actually real medical benefits from doing things like that. So there's a whole heap of things that can help for stress and mental well-being, which is just so important.
And look, we've got a question here about how cancer patients can ensure they're choosing safe, reputable and effective complementary therapies. And of course, you've talked about WebMD in the Mayo Clinic. Is there any other way that people can make that selection or know that they're choosing effective therapies?
Yep. So those are the best websites. There are others. There are other good ones, and there's a real lot of nonsense websites. That's what worries me. And so they're 2 good ones. And of course, your doctor may be a good source. And again, I'm not blaming my medical colleagues. When I talk to medical graduates, they've often had about half a day of training in 5 years on this subject. And yet it's one of the things, for a GP that almost half their consultations may be about. I'm unusual. I specialize in this. This is my area of interest. So your doctors may give you good advice, but don't be surprised if they don't, because they're busy learning about oncology drugs. Maybe they don't focus on things like art therapy for stress. When it comes to the specific supplements and pills you might take, I always think a pharmacist is better to recommend on those rather than a doctor. And I can say that because I'm both. So I can say that, pharmacists are far more highly trained. So if you're worried about interactions or working with your other things, pharmacist is a source of advice.
So just on that, so years of working as a medical practitioner, so what sparked your interest to research complementary therapies? What led you to this in the first place?
Well, actually, I mentioned this on my TED Talk. If anyone Googles my TED Talk, which was about honey, actually. But yeah, look, I was specializing in medical research, so I was doing clinical trials for the pharmaceutical companies. I did that for a lot of years and really enjoyed it. And then and living in the Bay of Plenty at the time. And one day I just read a random study, just flicking through the medical journals, and it was from Dubai, and it was about local honey, and they'd used it as a treatment for cold sores. And it worked, and it was amazing. It was better than other treatments, and it was just that one single study. I thought, wow, there's probably a lot of things in the natural world that are just as good or not better. Nature's been developing things for thousands of years. There's probably a lot of stuff out there like honey that is really effective, but it just hasn't been studied, and it could even potentially be better. Maybe it's got fewer side effects. And then I went on to particularly study honey. And did that for a lot of years, and then other things as well. So it was just a chance reading of a paper that sparked my curiosity.
And sent you down a whole new path, which is wonderful. How fantastic for all of us. And I guess so that brings us to Look Good Feel Better. So why have you chosen to work with Look Good Feel Better, and what do you hope to achieve through this collaboration?
Oh, well, I was asked. I was asked, and I said yes. So very, very simple. But I enjoy this sort of thing. All humility aside, I've been studying this field for 20, 25 years. I've given dozens and dozens of seminars like this, talks to health professionals, to patients, and I enjoy it. And if I've learned a little bit and I can pass that on and help people to make better choices, and to help with their well-being, particularly in a difficult time, what could be a better thing to do as a doctor?
Fantastic. And look, that's the whole philosophy behind Look Good, Feel Better is, we're non-medical, but we want to support people's well-being, which is fantastic. Now, Shaun, that does bring us to the end of the questions that we had scheduled for our your and my little chat together. We have had some questions come in that people have sent in beforehand, so we'll go to those. But for our wonderful community around there, we've got... if you would like to ask a question, if you can pop it in the chat, and we'll try and get to it when we can. But I'll just go to the ones that have come in first. So there was one there just asking or inquiring about full body aches and acute constipation. If you've got any sort of kind of like areas or anything you could add to alleviate or help somebody along those lines.
Yeah, okay. So full body ache. That could mean just, as it says, but also there's a condition, called fibromyalgia, where the whole body seems to ache, and we really don't know much about that at all. So really for both of those, there's a few things that can help. Generally no miracle cure for those, and often, I have to say up front, it's not often that I can just say there's this and it's a miracle and it's amazing, it's going to make it all go away. There's not many things like that in medicine, but there's things that may help, and of course some things help some people, not others. But for full body ache, definitely there's evidence for gentle exercise, so that would be walking or yoga, that sort of thing might well help. And I'm a huge advocate, by the way, of walking. I think it's very underrated. I think when people think of exercise, that have to go doing marathons or playing squash. You don't. Just walking, even is really, really good, and exercise for a lot of people. Acute constipation, you said. Again, it's really basics of medicine there. So fiber, it might be prunes or kiwi fruit. Lots of water. People forget that. Lots of water. We often don't drink enough. And exercise as well is related to constipation. The only other one you might not be aware of from the natural world is probiotics. I love probiotics. I've written a book on probiotics. More commonly associated with diarrhea, of course, and treating that, but also good evidence can help with constipation as well. So if you've tried all those other things, then probiotics to build up the healthy bacteria in the bowel may help as well.
Sure. And I know you've talked a little bit about some other sort of spices. What's your take on, say, the likes of turmeric? I guess you talked a little bit about ginger. So, is the use of cumin and turmeric?
Yep. So turmeric's probably the thing I get asked most about these days. It's a real hot topic, and that's fine. It's a fascinating substance. What we know that in a test tube, reducing inflammation. So we know that. It can also kill some cancer cells in a test tube. And that always gets people excited. Oh, it can kill. But unfortunately, a lot of things can kill cancer cells in a test tube. It's just the nature of it. And they don't often kill them when in the real life situation. Part of the discussion and around turmeric really comes from India, where it's so much part of the diet, and there's a lot less cancer, particularly bowel cancer. So people have made that link. Maybe the turmeric's causing that, but there's other things going on. So the good news is that I think it's definitely good for arthritis, for joint pain. There's good studies to support that. It's recommended. However, the one probably people want, is it a cancer cure? I don't think so. It hasn't particularly been studied. A few small studies not showing any signals. I hope I'm wrong. Watch this space. But currently, I can't tell anyone that it's going to cure a cancer. But by all means, use it for joint pain.
Yeah, sure. There was another question here about complementary therapies after treatment. So anything that reduce in recurrence or improve recovery. So I guess you've probably kind of covered that, really, haven't you?
Yeah. So to specifically prevent recurrence, nothing really proven, other than just generally the better health you have, the better your chance of less recurrence and a better post-treatment recovery. And so what I mean by generally health, so obviously diet is a part of that. Maybe, particularly an anti-inflammatory diet. You can get whole books on that, which is often based around a Mediterranean type diet. Some great evidence for that. So that might well help. and again, exercise and reducing stress. The things I always talk about, just general good health measures. So just common health, just to be as healthy as possible. I think those are the areas to focus on.
Yeah, sure. We've got one here. Is acupuncture effective for nerve pain? What are your thoughts on acupuncture?
Yeah, acupuncture is interesting in that there's been a lot of studies and it's inconclusive. So often you get a lot of studies and it proves it one way or the other. Acupuncture is the difference. It's in the middle. So there's a lot of studies say it works, a lot say it doesn't. So it's safe these days. That's good. You know, people understand about needles and sterilization. At the very worst case, it's a really, really good placebo. And I don't know, it may be placebo or there may be more than placebo, but regardless, it's a really, really good placebo. And and so even if it works by placebo and not much more, I don't really have a problem with that. It's really, for me, in the category of try it and see if it helps. So if you've got something nasty like nerve pain and nothing's working, I've got a couple of other suggestions, but if nothing's working, you want to try acupuncture, there's really nothing lost in giving it a go. And if it works for you, if it's placebo, it's a little bit in the mind, but you're getting real benefits, I'm not too concerned. Give it a go. If I can just start, sorry, I'm waffling a little bit, but I am obsessed by the placebo effect and the power of the mind over body. I just want to give you an example of this because it sounds a bit wishy-washy, doesn't it? So when I was a pharmaceuticals researcher, we'd be testing new inhalers for asthma, and we'd get people to blow down a machine, and we'd get a result, and then we'd give them an inhaler. We'd just placebo in there, but we wouldn't tell them that, part of the research. And then a couple of minutes later, they would blow down, and it would be 40% higher number. That's incredible. That's the power of the mind. It's opening your airways 40%. No one understands how that works, but you can't argue with that. So that's the power of placebo. So a really good placebo, and maybe that's what acupuncture is, or maybe there's more to it. We don't know.
Yeah, I think it's something definitely worth thinking about a lot, isn't it? We're going to go. There's a couple of questions that have come in here in the chat. So one here, it's quite hard for me to find somebody to talk to about this, and the doctor that has prescribed me, or the oncologist that has worked with me, has now gone and not treating me anymore. Should I carry on with my GP talking about these things, or how will they know about cancer treatment and the side effects, and how to work through these?
Yeah, so it is tricky. So all I'd say is, just ask around, because some doctors specialize or have a big interest in this, and it's more and more now. So just ask around, and if your doctor tells you up front they're not interested, think it's nonsense, you might want to move around if you can. There are a good number of GPs who specialize in this, and non-GPs as well. There's a lot of health professionals in there with an interest and expertise in this field. So you will find someone if you look around and ask around.
Great, thank you. What about sleep? Is there anything that will improve sleep? I guess that's the $1,000,000 question for a lot of people.
Yeah, everyone's struggling with sleep, aren't they? So I think rather than taking something to knock you out, I think really it's the underlying focus. So de-stressing, so anything that de-stresses. So I talked about art therapy, music therapy, aromatherapy, massage, but anything to de-stress. There are supplements like magnesium and B vitamins may help. A specific supplement I like is one from tart cherries. There's a tart cherry extract, which is really good. It contains low levels of melatonin. Melatonin is a natural product, and in fact, I think I read it's just become available over the counter in New Zealand. I think it's just been as a change of regulation. I know a lot of people have campaigned for a lot of years around that, because in the USA you've always been able to just go and buy it from the pharmacy,
or smuggled it back from America.
Yeah, we've all done well. So people have done that I'm aware of. Yeah, so that they're all good for, good for sleep, but really try to de-stress, and just also basic what we call sleep hygiene in medicine. Just the basics. Don't drink a lot of caffeine late at night. Don't be getting all stressed about things late at night. Etc. So it is a tricky one. There are more heavy duty things you can take, but take them with caution. An example would be valerian. That's a plant valerian extract. I remember when I was doing my finals at medical school, very, very stressful time, couldn't sleep, so a couple of nights I had those to, almost knock me out. It's herbal, but it's potent. So, take it seriously. Don't drink alcohol with it, don't drive, don't operate machinery, don't take them all the time and become addicted to them. So there are quite a few things for sleep.
Yeah, sure. Quite a few people have got questions both in on the email and in the chat about what about for joint and muscle pain from anastrozole and tamoxifen? So anything particular there?
Yep. So, I mean, in joint pain, naturally, it's really, really common, as we get older, and also with a lot of treatments as well, they can exacerbate it. So what's good there? Well, I've already mentioned turmeric as an anti-inflammatory. So really, you're looking at anti-inflammatory. Anti-inflammatory products like turmeric. The other one, of course, is fish oil. And I've written a whole book on fish oil. I could talk all day about fish oil. And if you want, I'll digress a little bit because people get confused with what to take, etc. So fish oil, anti-inflammatory diet. I've mentioned at the start a TENS machine, which can give a little electrical nerve stimulations through your joints. That might help. And then the other one I really like is called capsaicin. Capsaicin. That's an extract from chili peppers, and you get a lot of heat from it. So it's called capsaicin. If you can't remember capsaicin, if you ask the pharmacist for the chili pepper cream, they'll know exactly what you're talking about. Just be careful. It's very, very hot. Make sure you wash your hands after. And just to go back to the fish oil again, how do you know what to take and what dose? I mean, I give a whole lecture on this, but very, very briefly, if you've got a joint pain, you want to treat it with fish oil, the dose you need is six capsules. So a standard capsules is 1,000 milligrams. You would need 6 of those, and that's a lot actually. And they can be quite big, so have them with a lot of water. You can get double strength. So if it says double strength on the label, that's what I have, then you just need 3 of those. So that helps. So 6 of your standard, 3 of your double strength, with lots of water. And which one? Because when you go into the pharmacy, there's so many to choose from, isn't there? And you get these big buckets outside as well on special. And just a few things like fish oil, I say, spend a little bit more because you will generally get a better product. Some of the cheaper products can not have what they're saying there. They can be rancid, even potentially harmful. So from a good reputable company, someone you've heard of, I don't know, Blackmore's or whatever, a reputable company, and pay a little bit more rather than the cheapest for a lot of supplements, but particularly for fish oil.
Sure thing. High dose IV vitamin C.
Yeah, a tricky one, and I may upset some people here. Apologies in advance. I'm not an advocate of this treatment. You can Google me. I've had debates on TV with people. I wish it worked. I'd give anything to make it work, but I haven't seen any evidence that it does work. And there's a little bit of potential harm in that it has given people some kidney problems. And depending on what your other treatments might be, it could potentially harm those treatments and stop them from working, because vitamin C is an antioxidant. And some cancer treatments work by oxidizing, so you're going to block them. So you've got to be really aware of that. But, there are a small group of doctors in New Zealand who are strong advocates on this. But I haven't seen any evidence in clinical trials in people that it works, unfortunately. And it would be relatively easy to do, to prove, but it hasn't been proven. I know a lot of people try this. They get excited by it. There's a lot of pseudoscience around. There's a lot of nonsense out there. But, there's a lot of genuine doctors and people who do think it works, and that's great. But all I can tell you, the truth is, I wouldn't take it myself in that situation. And I hope that I'm proven wrong and someone does a study and it works, and I'd be the strongest advocate out there. But currently it's not proven to work, and a small chance of harm.
Yeah,
and it's expensive, and it's expensive and takes a lot of time. So you're gonna factor that in as well.
Okay, cool. Now we're getting through the questions. We've still got quite a few to go though, but just Shaun, what about removing sugar from your diet?
Yeah, again, I'm just not an advocate on this, I'm afraid. It's quite fashionable at the moment. The theory as it goes is that you're starving the cancer of the sugar, as I understand it. But that's just not how the body and physiology, works. You need energy to be healthy, to be fighting the cancer. You don't want to be starving yourself of sugar, and your body will create the sugar from somewhere else. So, it'll create it from your food or your fat reserves or your muscle reserves. So I don't think it's actually going to achieve the purpose. So I can understand why people would think about this. But again, it's one of those where I really hope I'm wrong and, someone shows that it works. But currently, I don't recommend it. Personally, I think it would probably do more harm than good by taking energy away that you need.
Sure. Okay, thank you. Suggestions to help nerve pain, so especially fingertips and feet, and this will be something, many people will suffer from.
Yep. So very, very common, very, very nasty. So there's two things I've already mentioned there. So that's the TENS machine, transcutaneous electrical nerve stimulation. You can get them all over the place now. What I like about that machine, by the way, is that used to be an alternative treatment. It's seen as crazy. And now it's completely mainstream. Just about every woman in labor would have a TENS machine. Physios all have them. You can get them from a physio. They're really good. They basically give out small little tingling electrical currents, and that effectively blocks the pain. It blocks the pain fibers so they can't transmit the pain. So it can be really effective for a lot of people. And the other one I've mentioned before is the capsaicin. The chili pepper cream is particularly good for that sort of nerve pain or neuropathic pain, as we call it. Just be careful, just put a little bit on. It can be really hot. I like it, but it can be really hot. It's the heat from chili peppers. And again, wash your hands after. You don't want to be touching your eyes after. Or how can I put this subtly? You don't want to be going to the bathroom after. You may be setting a world land speed record.
No other areas, yes, of course. Thank you. Look, we've got a lovely, lovely message here. Thank you for taking the time to help us and all the work that you do. I'm a massage therapist who is specifically training in oncology massage as well as having recently had cancer treatment myself. And your book and information have found from you online have been great. So wonderful, Shaun. That's a really lovely, lovely message there. Look, I think we've probably maybe only got time for one more question. I've got in here. My naturopath has recommended Rybrax at quite a cost. So have you heard of Rybrax and what's your thoughts?
It's well, I'm just laughing. No, I haven't heard of it, and I'm just laughing from what I said before. That every session I ask something I've never heard about because it's never changing field. So look, the truth is I don't know. What I would say is, look, if you go to those websites I suggest, I think I think they'll give you some information, but I haven't come across it, I'm afraid.
Okay, cool. I have just got one more here. Any specifics for respiratory relief?
Well, it depends what's going on, really. So if you've got any sort of inflammation in there, if it's a bit of asthma or COPD, then potentially omega-3 and fish oil can help. In an acute situation, if you're really struggling, there's evidence for magnesium, but really that's part of standard treatment now in the A&E departments. But yeah, it depends what's causing the respiratory problem. So it's a little bit of a wide question, but for inflammation, those things.
Yeah, sure. Okay, and I'll do last one and then we'll switch over to Claire. So what's your opinion of glutathione? Glutathione?
Yeah, glutathione. Again, it's a lot of people taking interest. Again, it's one I just don't have an opinion either way because there's just been no good studies that I've seen. So yeah, sorry, I don't. And I can't answer give a good answer to every question. That's one of them. So it's an interesting chemical compound, that's for sure, with a lot of properties. But is it effective? Yeah, I just don't know.
Okay, cool. I'm gonna do one more, and then we'll have to keep moving. So one more has just come through here. So it's looking at herbal preparations to treat parasites, where parasites are thought to be a cause of the cancer. I'm not sure if that's if that's anything you're able to answer.
No, this is new thinking and not only research. So unfortunately, I've finished with a three sort of slightly, I can't say much, but I'm afraid that's in that category as well.
Yeah, I think that's kind of like just summing up the fact that there is so much out there, isn't there? And for everybody just to find the things that are working from them. So yeah, and we have got here in the chat is that we do have a limited number of your book, Shaun, and they are available on our Look Good Feel Better website. So you'll be able to go onto the link there. Now, I think we may have our wonderful General Manager, Claire, coming on. Claire, are you there? I think you were going to say a few words.
I am here. Hello. And good evening to everyone. And firstly, just a huge thank you, Shaun. Every time we meet and I listen to you, we learn so much more. And just a heartfelt thank you for doing this all the way back in my home country as well, which is awesome. And your expertise and just your knowledge and the way in which you framed it today for all the participants. It's one of the reasons why we run the Q&As, is that we're not experts, we bring the experts in so that you can actually gather as much information as you can. So Shaun, this has been an incredible session. This actually marks the beginning of International Wellbeing Week. And so Shaun has kicked it off with fairly sort of major sort of work within there. And just to let you know that we're continuing to expand our wellbeing classes. Look, this week we've got a breathwork class, which the last time we ran one, 3 participants actually fell asleep during it. So maybe some of the gentle walking and some of this, as Shaun has recommended, may help some of those areas as well. And our chair yoga, which I know Pauline and others have attended within there. And just, you know, have a look, see what's actually there, give something else a try. Well-being during cancer treatment continues to be our focus, and we really are committed to expanding our well-being sessions, and we've got a lot more lined up, including restorative stretch and gentle Pilates as well. I'm actually talking to someone in Nelson about art therapy, Shaun, so I was so delighted that you mentioned that. It won't be something I'll be doing because I'm no good at art, but you know, it's all there. And thank you all for taking the time this evening, but thank you all for the questions that you had today, for the questions that you've sent through. It's just been amazing. We were curious about what part did complementary therapies play, and we needed to have an expert in there. As mentioned, there is the book, Complementary Therapies as well. Dr. Shaun donated the books to us very kindly. So there is obviously a cost to them, to courier and everything, but again, it's all his research from there. And it's one of the very few books that there is around in the world that's actually tested everything and says yes, no, or maybe. So thank you everyone for joining and for your participation in this. And I'd just like to hand back to Rachael. Rachael, thank you again for facilitating. It's always wonderful for yourself and Paul, who's on here as well, to take the time to be able to do those things. I'll hand it back to you to wind up, so because you do that so beautifully. But thank you all for taking the time this evening.
Wonderful. Thank you, Claire. Look, just on that, everyone, we have come to the end of our session. Now, I know we didn't get through all the questions, and there have been some more popping up. There's lots of thank yous in the chat there, which is really wonderful. And I know someone said earlier about Shaun, they're very grateful because they're feeling very confused and overwhelmed by information. And I guess that's something, you know, that happens right at the start. There's that whole overload of information. So yeah, it's wonderful for you to have come on and brought some sense to it. So on behalf of myself and our wonderful community of people that are on screen tonight, would like to very much, and Look Good Feel Better, say thank you very much for taking the time to share your insights with us, as well as the books, and yeah, getting up nice and early in the UK and joining us here in New Zealand. So Shaun, any last words from you before we close out?
No, thanks very much for the comments in the chat. That's really nice. Glad to have helped, and happy to do this anytime in the future. You know, we've only actually scratched the surface.
Yeah, for sure. And, we will try and get another session in, because we know that we've got lots and lots of questions in there. So we will try and do a catch-up session as well. So thank you very much, everybody. Lovely to see all your wonderful faces from around the country. Thank you very much for supporting our Look Good, Feel Better Q&As. And we very much look forward to seeing you at the next one. Take care and wrap up warm. Ka kite, everybody.